Hi, I'm Tara Watson-Watkins, President and CEO of the Lufkin, Angelina County Chamber of Commerce. Welcome to the Connect podcast, connecting business to the community. I'm here today with my co-host, Blake Pollino with BP Media Group.
We love doing these type of episodes, and they're surprisingly popular when we have a local physician come on the show and talk about some health situations that you may not know about, different diagnoses and symptoms that can help you and your health in life. So this week, we have Dr. Erica Fidone with Woodland Heights Cardiology here to talk about just that. So let's jump into that episode now.
The cost of IT in business can be staggering. From hardware and software expenses to services like internet and phone, you don't need to spend a fortune on IT to succeed. If your organization spends more than $500 monthly on any service, or you're considering signing a long-term contract, IT Enabled can help you manage your technology and minimize your costs. Contact us today to schedule a free consultation. IT Enabled, we're here to help.
Erica, we're thrilled to have you on the podcast. Thanks for joining us.
Thank you for having me.
Yeah.
It's a very important month for my type of practice, so it's exciting to be here.
Perfect. So why don't you tell the listeners, you're a homegrown girl.
Yes.
Successful, came back here. So let's give a little bit about your background, and then we'll talk about it.
Absolutely. So obviously I'm a native Lufkinite, and my dream has always been to come back home. You know, I knew very early on that I wanted to pursue a career in medicine. I come from a long line of physicians, but growing up, I always knew my end goal after I went off and got all my training was to come back and help. And I didn't always know what I wanted to do as far as medical training goes. But once I figured that out and I saw such a huge need of a field that I have now fallen in love with, which we're going to talk about today, I knew Lufkin was absolutely where I had to come. So I went off, decided to do training in cardiology. And then I realized that I really liked saving and helping the sickest of the sickest. So I really fell in love with something called interventional cardiology. So that's basically where you help treat heart attacks and you put in stents and truly save people's lives. And then I was blessed enough to have this opportunity to go train with a gentleman in Southern Louisiana, and his name's Dr. Craig Walker. And he basically is one of the founders of a field called endovascular intervention. And basically what that is he has championed helping people with blockages in their leg arteries. And by helping them, he saves their legs. So what we know is with amputation, when somebody has an amputation, especially if it's from blockages in the leg arteries, that significantly increases your risk of death. And so he is from a small town in southern Louisiana called Houma, Louisiana. And when he went back to his hometown, they had the highest amputation rate in the country, that county, or that parish, I should say, being southern Louisiana. But now it has one of the lowest. And it's purely because of his dedication to his patients and the dedication to the cause of saving limbs saves a life. That's what we say. And so I was able to go down there, and now he's a world-renowned expert, and I was able to train with him one-on-one for a whole year, and that's all I did. Is help save limbs. And that has changed my life, and it has opened this whole new field of where I can help patients. And so coming back to Lufkin, Angelina County has such a high amputation rate, and it's time to get that amputation rate down. And so that's why I came back. One of the huge reasons I came back beyond just I love Lufkin in Deep East Texas in and of itself. And this is a space in medicine that somebody needs to take a hold of and really take ownership of and help these patients. And so me, along with my husband, we decided to come back here. He's also a native Texan, and he helps me help save limbs as well. So he has training in that. Yes, he's also a cardiologist, and he also has extra training in helping save legs. And so the two of us are trying to build a practice where we can help as many patients as we can in Deep East Texas. So it's awesome. Exciting. Yeah.
I love it. We have fun trends that pop up on the podcast from time to time. One of which is that you've talked about is the leaving and coming back to Lufkin.
Yes.
We see it time and time again on this podcast. But the other are married physicians. So physicians who
Yes.
marry doctors who marry other doctors.
Yes.
Like that's an
Yes.
awesome trend that I see, and I think that's so cool.
Yes.
So are y'all working together? Is that?
We work together, yes. So I say we're partners at home and at work. We're partners in all aspects of life. But, honestly, we get approached a lot. Like, is it difficult? Do y'all get tired of each other? And honestly, we met in medical school.
Okay.
That's all you
And
knew.
that's
Yeah.
all we ever
Yeah.
have known. And honestly, I trust nobody more implicitly than I do him.
That's great.
And same likewise, we certainly have the same goals and passion when it comes to how we approach healthcare and patient care. And so to be able to do that with your life partner, I mean, to me, I wouldn't have it any other way.
Well, and you come from a long line of physicians.
I
Not
come
only
from
is
a
your
long
dad,
line.
who everybody knows, Dr. Fidone,
Yes,
pediatrician,
yes.
but your grandfather was a
His
pediatrician.
dad was, my dad's brother is.
Yeah.
I have multiple cousins who are physicians on my dad's side. So yes, we have a long line of a medical family. So
That's great.
that's exciting. Yeah, it's been fun. It's in the blood.
That's awesome. So let's talk about, with us having a high risk of amputations, I
Yes.
assume that's because of diabetes.
Right. So exactly. So what are risk factors and what we're talking about is something called peripheral arterial disease, or PAD. The more severe form of that is something called critical limb ischemia, or CLI. And that's really where you're going to perk my ears if I meet you in my clinic, if you have something called CLI, because then that astronomically increases your risk of amputation. So what are risk factors? Absolutely. A patient with diabetes, it's the risk factors you would think of. Diabetes increases your risk of having blockages in your leg arteries by 3 to 4 times. So somebody with diabetes around starting the age of 40 to 50, they need to start being screened for peripheral arterial disease. Any history of smoking increases your risk astronomically of PAD, whether you're a current smoker or a former smoker. So those patients around the age of 50 need to start being screened. And then some of the other risk factors that you may think of that go along the lines of heart attack and stroke. So high blood pressure, high cholesterol, morbid obesity, all those things. And then also family history does play a role. So you do, it is helpful before you go and have your annual checkup, maybe talk with some of your family members and if they're willing to disclose if they have ever had a heart attack, a stroke, or blockages in their leg arteries, then you may need to be screened too, because there is a familial component to that.
So you got into that a little bit, but what should people be looking for signs and symptoms wise? So if they don't
Right.
know that they have any of these additional diseases, I guess is the word for it.
Right, absolutely.
What are some symptoms people should look
So for peripheral arterial disease, it's about 40 to 50% of patients are completely asymptomatic. And so that is why
That's scary.
It's very scary. That's a coin flip of whether you're symptomatic or not. And so that's why this month of September is PAD Awareness Month. And it's so important because, as patients, we have to take ownership of our health and we have to be our own best advocate, because they've done studies with PAD and they've shown that a significant percentage of patients, even during their annual physical, PAD screening never even gets brought up, even in patients with risk factors. And so not only are the healthcare providers aren't looking for it, but the patients don't know to even bring it up because they don't even know it exists. And if they don't have symptoms, then how do you do it, right? Wow. And so it's about raising awareness and getting patients to fight for their own health, and then getting the healthcare providers to start asking about these symptoms. But if you do have symptoms, it could be when somebody walks, you could get significant calf cramping that goes away with rest. Well, say, you have somebody who's in one of their older decades, they get calf pain with walking. What are they going to think that is? They're going to think, I'm getting old. 90% of patients think that their PAD symptoms are just them getting old. It's like, no, this is a true pathologic process that we can treat, and it's easily treatable. So calf pain with walking that goes away with rest. Discoloration of the feet or the toes, noticing that your toenails aren't growing like they should, or you're not getting hair growth on the lower part of your leg like it should. Any kind of darkening of the skin or thickening of the skin, flakiness of the skin could be a sign. The biggest sign, and oftentimes we've kind of missed the boat at that time, is if somebody develops a wound on their foot or their toe and then it doesn't heal. And then it just becomes bigger and bigger. And then that starts that process of, it could develop into gangrene, and then we end up with amputation, which increases your risk of death significantly. And so, it could be something as simple as my feet get cold at night. That could be a sign. But the scariest is, like I said, it's 40 to 50% of patients are completely asymptomatic.
So why are other physicians during your physical not checking for this? This can't be something that's that new.
It's not that new.
On.
I think I think that's a multifactorial problem is we're living longer, so we're getting more medical maladies and comorbidities. And so, we're already overwhelmed in healthcare. And then we have a patient come in with a list of 25 medicines, and we're trying in a slot of 15 minutes of what we're allotted to try and address every little thing that they have. It becomes difficult as a physician. It absolutely does, because you're trying to address nose to toes issues in 15 minutes. It can be hard. It can be very difficult. And so I do think that we need to become more streamlined of, if somebody already has hypertension, if somebody already has diabetes, just a PAD screening is an automatic thing. And it kind of takes that guesswork out of it, the time out of it. I'm very much an advocate. If somebody has high blood pressure, diabetes, or high cholesterol, just send them to me. Just send them to me, and I'll screen them. Because I'm the one that ends up treating it.
Right.
If they ever need a procedure to treat it, or I can help facilitate getting them to a surgeon if it needs to be surgically treated. So, I think as healthcare, we just need to work together. I think getting the awareness out that there's plenty of physicians that do treat this. And it starts with the cardiologists in our area that help treat it. In other towns, it may be a vascular surgeon that treats it, or a special type of radiologist that treats it. But, I think just us working together in healthcare to really, again, take ownership, get them to me, get them to a cardiologist, get them to a vascular specialist. I think that should be an automatic if somebody has the risk factors.
So let's talk about how you evaluate someone, because it's not scary. I've had the evaluation done.
It's not scary at all. It's not painful at all. For me, how I evaluate it is I just start with simply by talking to the patient, listening to them. Do they have any symptoms? Do they have the risk factors? Let's sit down and have a conversation about it. Because again, they may not know the symptoms. And then I'll bring up a symptom like, you know what, I did notice that. And so let's just start there. Second, physical exam. In my clinic, and patients either love it or hate it or think it's weird, but from day one, have a no shoes and socks policy in my clinic. So if you come in, you're going to be asked to take your shoes and socks off. And I can't tell you how many people say, you're the first doctor that's looked at my feet in years.
Interesting.
And it's an automatic. If you're in my clinic, I'm going to examine your feet. I'm going to examine your toes. I'm going to look for any wounds. I'm going to look for hair growth, nail growth, you name it. I'm looking for it. And then obviously I'm going to feel your pulses and look at your circulation. So again, not painful. It's just about doing the work and looking for it, knowing what you're looking for. And then, there's multiple different imaging modalities you can get. So you can get an ultrasound, again, non-invasive. You can get a CAT scan, a special type of CAT scan that may show something. There's another type of test where they kind of measure all the blood pressure between your arm and your legs. It's called an ankle brachial index. Again, non-invasive. It's very easy to look for, and again, insurance typically pays for this if you meet all the risk factors, which a lot of our patient population does. And it's so easily treatable. I think that's the biggest thing is if we just catch it early, it's so easily treatable. And that's why awareness is huge.
That's awesome. Is there an age range that you're seeing this most common in, or a certain risk profile for that?
So it does increase as we age. So once you hit the age of 70, your risk of peripheral arterial disease significantly increases. But the scary thing is, and it's not just with peripheral arterial disease, it's with cancers and heart disease and all, is we're starting to see it in younger generations. So now we're starting to see it in 40-year-olds who are morbidly obese and who smoke, who may have a family history of it, who now have diabetes. Now we're starting to see 40-year-olds and 50-year-olds with it. And that's a scary trend. And that's, again, why going to your doctor's visits yearly and knowing that this exists and saying, hey, I think I need to be screened for that, and really pushing for it and advocating for yourself.
Very interesting.
Yeah.
What is the treatment like if you are diagnosed with this? What does that look like?
Yeah. So, if we catch you early, at that point, it's just about modifying risk factors. So it's about making sure your blood pressure is controlled perfectly, making on whether it be with medicines or lifestyle, so diet and exercise, making sure we're not smoking and helping you get off smoking and abstain from smoking, because, we should help with that as physicians and not just say, oh, you've smoked forever, you're never going to smoke. No, we always need to bring up that conversation. Helping with cholesterol. We have multiple cholesterol medicines out there now, beyond statins. I know statins get a bad rep, but beyond statins that we can help treat the cholesterol. And then, things like aspirin, a daily baby aspirin, and some kind of, I like to call them super aspirins, but they're called antiplatelet medications. So getting the patients on those. And then, having them start what we call a structured exercise program. So where I work at Woodland Heights, we have a structured exercise program at our cardiac rehab facility specifically for patients with peripheral arterial disease. And they come in a few times a week. I've made the protocol, my husband and I did. We made the protocol of how they do their exercise, and it helps not only stave off symptoms and helps with quality of life, which again, as physicians, that's what we're trying to help, is their quality of life, but it helps prevent amputations and prevent loss of limb. And so all those things, whether it be exercise, medications, prevention is key in treating. And then say somebody does have a wound, then yes, there are invasive options, whether it be minimally invasive, which is how I was trained. I call myself a glorified plumber. So it's all minimally invasive. There's no cutting, there's no sewing. It's all with wires and catheters that I try and go open up the arteries, or again, with vascular surgery colleagues, if somebody does need a true surgery to help with that, we can help facilitate getting into somebody who can do that. So sometimes we unfortunately do have to do the invasive options, but again, it's to save a patient from amputation. That is the goal, is saving amputation.
That's amazing. And is that stuff, this is all stuff that you can do locally here in Lufkin? Yeah,
so we can do the minimally invasive stuff locally, yes. The surgical aspect we can currently do in Lufkin, yeah. But, the goal is to keep it as minimally invasive as possible. And a lot of even vascular surgeons now are doing all this minimally invasively as well, because the risk is less. And obviously patients like it better. They hear surgery and they freak out. They hear, oh, it's just minimally invasive procedure, and that's much different. And so, yes, we can do all that here in Lufkin. And I work very closely with not only colleagues, there's multiple specialties that it takes to help treat peripheral arterial disease. And I don't want to have this podcast in without acknowledging those specialties. When I first got here to Lufkin, they asked me, who do you want to meet as far as healthcare? Who do you want to go around and meet? And the first two people I said was wound care centers and podiatrists, because I work so closely with them. I mean, podiatrists especially, they're looking at feet all day long. Sure. Wound care centers are looking at wounds all day long. I said, how can I help y'all? How can I help? Because I'm just a small piece of that puzzle in restoring blood flow to help heal a wound. But y'all are the first line defense. And so, I've worked very closely with them now, and it's been really fun to kind of create this new little thing that Lufkin hadn't had before. And it's very exciting, where we all work together, and they're calling me and I'm calling them about a patient to try and help save their limb as much as we can.
That's fantastic.
Yeah.
Incredible. We're just so proud to have you back home, and for the work that you're doing, and the fact that you've really brought awareness to East Texans, because we know that we need it. We're not a healthy community.
Right.
And it's things that we need to change in order to have happier and healthier lives. So
absolutely. And if I could just, say one more thing again, I'm all about patient being advocates for their own health care. There is a group of 4 medical societies that are focused on vascular health came up with a patient resource. It's called padpulse.org. You can go there. It's extremely patient friendly. They have multiple videos talking about what peripheral arterial disease is,
Right.
the symptoms of it, how you approach the conversation with your healthcare provider. And they have a campaign called Kick Off the Conversation. It means kick it off with your healthcare provider. So they ask for 3 things: know your risk for peripheral arterial disease, go see your healthcare provider, and then kick off that conversation. Ask them about it. So padpulse.org, patients can go look at it. Caregivers of patients with it can go look at it. And there's tons of resources, even finding a physician in your area that specializes in it.
Perfect.
That's incredible. So if our listeners think they may have symptoms, think they may be asymptomatic, and they want to go get checked out, how do they contact you? Where do they do this? What's that process?
Yeah, absolutely. So obviously they can talk with their own primary healthcare provider, but if they want to come see me or my husband or our nurse practitioner, Dustin, we're at Woodland Heights Cardiology. We're right next to Woodland Heights Medical Center. And just call our office. It's 936-633-1230. Just call our office. I'll be happy to see you.
Perfect.
Yeah.
Thank you.
Thank
so
you
much
for
for your
being here.
time. Yeah.
Thank you for having me.
Yeah.
Thank
Thanks
you
for
so
telling your
much.
story. Thank you so much for listening to the podcast again this week. Please go have this checked out. Some of our most popular episodes of this podcast are some of these medical PSAs that our listeners love to listen to and share. So share this with someone who you might think finds this interesting, or maybe you might suspect has some symptoms, or a spouse or a friend or a family member. And thank you again so much for listening, and we'll see you next time.